Hello, everyone. Today I'm with Iván Zavala and Corey Dillow, and these two gentlemen will be presenting a course soon on Neijing acupuncture. And today we're going to have a bit of a discussion with these two and ask them a few questions to give us a little bit of information about this course. So, the first question we're going to ask them is to give us a little bit of an introduction to themselves and discuss their history and relationship with Chinese medicine.
Sure, I'll start. Thank you, Michael, for organizing this interview with both of us. Um, as some of you know, I'm also part of, me and Michael are part of the Academy of Source-Based Medicine. And we run also a membership site um, that helps others kind of get acquainted with like Chinese medicine masters, essentially, and ancient classical teachings. But in relationship to who I am, for those that don't know, um, I I'm a I'm a clinician at heart, okay? And but for me, I've always felt that to really access the full apex or the full aspects of clinician, I had to kind of learn more scholarship. I didn't intend to go into Chinese medicine and become a scholar. Uh, and I wouldn't still think of myself as a scholar, but I had to attain more scholastic abilities. Um, and that helped unlocked to me a lot of Chinese medicine resources. And since then, because I unlocked this for myself, it essentially allowed me to become or specialize in classical research and classical literature. And since then, I have taught it internationally for a number of years now, and have pretty much answered thousands of questions now on all aspects of the Chinese medicine literature. So yeah.
Thank you, Ivan. And I'm sure while you humbly might say you're not a scholar, I think most people would call you a great scholar physician. Now, Corey, can you tell us a little bit about yourself?
Absolutely. So I studied at Pacific College. I began studying Tuina Asian bodywork and then moved into the study of acupuncture and Chinese medicine from there. In my early studies, I really started to feel like I wanted to not only, form a deeper connection with the medicine, but, gain the ability to reach primary sources and, explore the history of the medicine, in a deeper and more comprehensive way. So like Ivan, I also found that I needed to be able to access Chinese language, to do that. And, I ended up studying with Nicholas Herman Oving, learning my foundation in Chinese, and then continued from there in self-study. And as time went on, I, not only looked in early writings myself, but started to read the research of modern researchers of classical Chinese medicine and classical acupuncture, and really deepen my knowledge and study from there. And that study has tremendously influenced my view of the medicine and the way I practice the medicine.
Now, can you guys tell us a little bit about why you feel that the Neijing is not only a fundamental text for the study of Chinese medicine, but crucial to the study of acupuncture?
So yeah, to me, I mean, the Neijing has always been the pivotal aspect of Chinese medicine study, I think, through all Chinese medicine. Like every famous physician will probably mention the Neijing as a foundational text. And even the Neijing itself as a text, um, scholars will read it. Scholars who weren't into medicine will read it because the Neijing, besides a medicine text, it's also a text that speaks about many different things like Chinese medicine philosophy, Like Chinese scholars had to know about five phases too. They might not have applied it to medicine, but they might apply it to other aspects of life. So the Neijing is a larger than life kind of text, you know. It talks about cosmological formation. It talks, but beyond those things, at its core, the Neijing is rooted in clinical reality. And that's what I feel is the most pertinent thing because there's many philosophical, um, well, more in Chinese, but some in English. A lot of the texts that have to do with the Neijing are all philosophically bent. And there's nothing wrong with that. I actually enjoy those texts too. But they are often going to just leave you with ideas swirling in your head and nothing tangible on how to apply those ideas. And these the Neijing at its core, I think teaches that program, that schematic. But the way to decode it, that schematic, well, there's different avenues to that. And the avenue that we're going to approach it is through the scholastic academic studies of the professor Huang Longshan, um, which we'll go into in a bit.
Well, now, Corey, can you tell us a little bit about Huang Longsheng and what he's done in terms of study of not only the Neijing, but also for once again acupuncture and how important you think he is?
Yeah, so Huang Shang is a really prominent modern researcher of acupuncture theory, of acupuncture's historical development, and of acupuncture literature. He's spent probably the last 40 years doing in-depth, systematic research of many fundamental topics associated with acupuncture. And so, a big portion of his research is dedicated towards the development of channel theory or Jinglo theory. And he takes all of the available historical writings, commentaries, excavation texts, drawings, artifacts, like everything that one can reference, and pieces together a really detailed portrayal of how such a theory is created in the first place, how it develops, how it changes throughout history, how it's used at different stages of development, and so on. So it's really a tremendous body of work. Beyond that, he's done extensive research into the development of acupuncture points, how their indications are handed down throughout history, solves different discrepancies amongst points, if they have the same name, and things might get conflated historically. So he's done a lot of work there. And beyond that, he's just contributed a lot to the understanding of classical acupuncture's conceptual scaffolding. How does it all come together, and what are the different components of it? What are the, diagnostic models, clinical models, techniques, and so on? And I think that, some of his aims that might be different from many modern researchers is that he's trying to contribute something both to clinicians and influence the depth and breadth of a clinician's knowledge in applying these different clinical models, but also in the trajectory of laboratory research or experimental research. The clearer we are on these ideas, the clearer and more accurate premises we can come up with for future research.
Thank you.
And also, to state that about the Neijing again, like you could approach the Neijing can inform all aspects of acupuncture in terms of different styles, right? So you could read the Neijing from a TCM perspective, and it can inform your TCM acupuncture. But the thing when you do that is, well, it might amplify your understanding still of your theoretical basis of Chinese medicine, you're still not fully accessing the Neijing, because the Neijing itself um, has its own scaffolding, as Corey basically mentioned. And before Hualongshan, that scaffolding was a bit vague. Um, so Hualongshan helps kind of reframe it and basically reconstruct it for us, right? Deconstruct it and reconstruct it.
Would you kind
So
of say it's like you have all the components to build a house, but he kind of shows you what the house is, how the house was actually built.
exactly,
Yeah.
exactly. So we are trying to impart that closer to original style to to the Neijing, because I'm sure that me and Corey still kind of practice differently, but we are closer because we are both kind of concerned with that original style of the Neijing.
All right, Corey. Now we're going to ask you a few specific questions regarding the aspect of the course that you're going to be teaching, which is the vision needling. So can you tell us a little bit about why you feel that this is an important topic to discuss and why you have chosen it to teach?
Yeah, so division needling or funsa is an early classification of needle techniques that can be found throughout the Neijing. And there's a chapter called Guanzhen Lingshu 7 that lays out a number of these techniques. Beyond that, actually, there's a recent excavation text from a site called Laoguanshan, and the text is called Sishu. And within this early text, from the late Warring States, early Qin dynasty, we already see that as a dominant classification of needle techniques. So what is fence or division needling? It is a classification of techniques that targets the subcutaneous space, essentially, the space from below the skin to above the muscle, or the area between two muscles, the empty space there. And these techniques are really geared towards treating a wide variety of conditions, including impediment or B syndrome. That could be cold B, painful B. That could be what's called GB or fatty layer impediment, you could translate it as. Sinew B. So lots of exteriorly originating painful conditions, numbness, tingling, paralysis, hemiplegia, cold and heat diseases, water swelling. So there's a really wide array of applicability for this class of techniques. And why I think it is significant is that not only was it such an historically important technique that influences kind of the whole trajectory of acupuncture, actually, it's also, um, I mean, for me, it's been very useful in clinic in treating the above mentioned conditions. But I'd say further, I think that there's kind of a lack of information available currently on the breadth and depth of myofascially oriented needling techniques that are contained within classical acupuncture. And further, I think even the just the information around the terminology of the anatomy or the just around the body that is associated with this. We just don't have much information on it. So, I'm really trying to give access to that information and give access to this wealth of clinically applicable information as well.
Thank you. So, Corey, can you give us a little brief summary about what role did this technique play in acupuncture's development?
Yeah, so funso or division needling expanded on this prior concept of the five body constituents, being the skin, the vessels, the flesh, the sinews, and the bone. So it expanded on this by adding this extra dimension of empty spaces around these structures. So kind of as we just talked about, division needling targeted the empty space from below the skin to above the muscle, the empty spaces between two muscles, and that kind of thing. So it expanded upon that previously existing model. And actually, you see, for instance, in the Neijing, when one is going to treat the sinews or the flesh, they actually specifically say to treat the funrogergian or the divisions of the flesh, so as to treat them. So they kind of start to take the place of treatment for some of these tissue layers. Beyond that, so acupuncture kind of moves from a blood-oriented model to a qi-oriented focus, I should say, from a blood-oriented focus to a qi-oriented focus. And simply what that means is that originally there was a big focus on examining kind of the color and shape of superficial vessels at the surface and directly treating them through bleeding, where division needling kind of comes in. It starts to shift the focus towards defense chi and treatment surrounding that. And it shifts the treatment towards the pulsating vessels at the body's surface and the regulation of the kind of pulse qualities in those vessels. And instead of treating them directly, it treats the space outside of the vessels. And so Funsa, it influences not only how like channel theory is utilized through the treatment of these pulse sites, but it influences an entirely new category of points called the chi cavities. It influences a development of points called the mu points that we're all familiar with. So it really just shapes kind of the whole developmental process of acupuncture.
Great, thank you. Now, can you talk about another individual who's obviously influenced your practice? Japanese person called Sugiyama Waicha, if I'm pronouncing that correctly. And can you
Yeah.
tell us a little bit about his association with this division needling and why you think he's important?
Yeah, so Sugiyama Waiichi is a kind of visually impaired acupuncturist that was alive in the Edo period in Japan. This would have been in the 1600s, around the time of the Qing dynasty. But he is credited with the development of the guide tube, something most of us use in clinic regularly. And, you know, beyond that, he actually didn't just use the guide tube as an insertion device. He used it as an actual treatment tool. So he really expanded the whole use of the guide tube into like a clinically significant application. Beyond that, he developed a large number of schools for the visually impaired, teaching acupuncture and massage, and transmitted a number of writings that lay out not only kind of all of the fundamentals of acupuncture, but also hundreds of needle techniques. And so that's really where he starts to connect to division needling, is that in his technique writings, not only does he say that Ling Shu Chapter 7 is an essential writing that practitioners must be familiar with, and that, those techniques must be known, but, some of his techniques are actually the same as those techniques that are just going under a different name at that time in Japan. So he adopts those. But some are actually just modifications or variations of division needling techniques. And he's greatly expanded upon these original techniques for further usages and further nuances. So that's really where I got the idea to link these two topics together and present this course.
Hello, Ivan. Can you please tell us a little bit about the impact of Huang Longsheng and his research and how it's related to Neijing.
Look, I've been studying the Neijing before I even went to Chinese medicine school. Right, I read the entire Suan at that time because actually Paul Unshold had just released his Suan and I just bought it. Um, and I read it and I thought I kind of understood it. And during school, I had read it because there's a lot of instructors who hadn't read it actually. And some instructors will be like, the Neijing and is cool, but there's a lot of things in it they'll say that don't apply today, And often I will hear this from people who never read it, or didn't really understand it. People that understand it don't really ever say that, I've never heard someone that's actually good at knows bit the Neijing say that it's not applicable today. And then I just continue my studies through different ways, commentaries and all that, certain teachers, teaching their perspective. But Hualongshang, what he does is he really unlocks to you many things that almost are undecipherable, or uh, and then the Neijing just clicks to you much further. So it's almost like without that aspect of Huangshan research, then the Neijing is still useful. Obviously, people before Huangshan were using the Neijing successfully because, as I said, it's a text that helps almost frame your entire perspective on Chinese medicine. But there's certain things that are not going to make sense. Um, and the Huangshan research just helps kind of pivot you and your Neijing studies much, much further. Um, it just basically makes the text decipherable.
Mhm.
And this is coming from someone that, when I started discovering Huangshan, I was probably already past 5 years of Neijing studies. So I wasn't necessarily a neophyte anymore, because, once I got into Chinese medicine school, I was already reading the Neijing at least for 2, 3 years. Um, and I think I read the Suwen like twice. And at that time, Ling Shu wasn't very available, so I couldn't really read the Ling Shu. But Huang Shang also his importance is that he's going to set the stage for us for later studies of particular styles of Neijing acupuncture that we're going to introduce. But even without studying those styles, Hualongshang research is going to set the stage for us for in-depth Neijing study that without him, those topics will be almost undecipherable.
So if I could kind of like ask you to clarify this a little bit, it seems to me like, and also when I've read the Neijing, like some of these indecipherable topics, it's like commentators and other people have sort of said, "Oh, I think it's this, I think it's that," but to me, it's kind of like you're saying with these research texts that Huang Longshan kind of says, "Well, it is definitively this." Is that kind of, and then by making it definitive, it then unlocks kind of how do you say like the almost like the treasure trove of understanding.
Exactly. So it's not that the people that came before Huanglongshang, in my opinion, were 100% wrong. That to me is kind of missing the spirit of the Neijing, because the Neijing is a fluid text. However, you could say in certain scenarios, like this famous commentators like Zhang Chitsong, um, um, Masher, right? This famous Neijing commentators, Zhang Zhang Jibin, all of them, well, they are incredibly astute, and I still have learned a lot from reading their commentary. So they'll still help you. So it's not like, to me, like Huang Longshan's study doesn't replace their commentary because often he quotes them a lot. So he still uses them. But the thing that we're missing in their commentary is that they didn't have the full breadth of research available to them, which I'm sure if they did, they would have come to, because these are some of China's greatest minds. So if they had the full literature available, I'm sure some of the commentaries will have been different. And Hualong Shang to me is kind of like them. Um, he has, I think, is very similar to them. Like if he actually existed in their times, we will probably put him in the same caliber as them. Uh,
I
and to
agree.
be, um, but the thing that amplifies it is that we now, apart from Hualongshang, have access to archaeological dig sites like Mawandui, Laoguanshan, Tianhui, and so on. And these texts are pre-Neijing texts, and kind of like the story of anything. How how do you know that somebody like how do you actually understand Confucius? Well, you have to understand his life.
Mm,
You have to understand the context of why Confucius wrote what he wrote. If not, it's kind of when you read Confucius, it doesn't have the same significance. So similarly, Huanglongshang sets the setting for the Neijing to make sense, and some
mm.
of those commentators didn't fully do that. They
Th-
gave
They
their
made kind
opinion.
of they kind of made very like some of the best educated guesses, but with like Huang Longshang, he kind of had access to the original sources, so it almost takes out that guesswork, right? But their guesses are
Exactly.
still very good, yeah.
It's very impressive, especially because they didn't have access
Mm,
to some of the technology that Huanglongshang has, and
mm,
we have like like electronic files, digital databases. This has actually made somebody like Huanglongshang also exist because he has that commentarial kind of spirit, but now he has access to, these digital databases that are being enhanced further and further with AI, for
mm,
example.
mm, mm.
And I'm actually, uh, I'm sure AI is going to amplify the studies even further
Yeah.
because we're able to textually analyze things um, in a broader way.
Now, and a very important topic in Chinese medicine is the Jingjin, which is sometimes translated as sinew channels, muscle channels, or even facet channels. Can you tell us a little bit about this topic and how you'll be exploring it in this course?
So, often the only people that talk about Jingjin is in the context of people talking about it in the sense of orthopedic.
Mm,
Like a lot of time people try to justify orthopedic acupuncture through the Jingjin or the channel sinews
mm,
schematic, right? And that is 100% correct. But those are the people that often try to use the Jingjin to try to justify their usage of acupuncture, of their myofascial needling. Then there's other people who kind of view them as their own separate channels and stuff like that. But those things are okay. But once you actually, what Huangshan shows us that the Jingjin actually are a lost theory, lost. And there's many things about because as Jingjin almost existed or was or developing separately from the Jingluo model.
mm,
Because it's the Jingluo model is what we mostly know as like the foundational framework of acupuncture.
what we call the
But
primary channels, yeah?
yeah, the channels and collaterals, right?
Mm,
Like the
mm, mm,
12 or 14 channels,
mm,
right? The lung channel and all that, the Ren and Du. And that's what people, when you go to acupuncture school, that's what we study. And then if we're lucky, we sometimes go into Jingjin.
mm,
But even those Jingjin s- uh, classes often miss a lot on the Jingjin because the Jingjin, the channel sinews, what what they serve is in even though it got lost because a lot of the Jingjing techniques were kind of ambiguous, okay? They weren't as clearly written about as the Jingmai, okay? So it's almost like Jingmai, um, the author of the Ling Shu, it's almost like he almost used the Jingmai more because it kind of helped his theoretical outline more,
mm,
right? Whereas the Jingjin didn't help um, as much. Now, if you look at the Ling Shu itself, chapter 10 is where he talks about the Jingmai, and then the next chapter is the Jingjin. So it's like you still couldn't fully separate them. And the Jingjin itself, as we're going to study, has a lot of theoretical framework that is separate from the Jingduo. And then there's a connection to the Jingduo. And so even though the Jingjin was forgotten, it's still intertwined in Jingluo theory. So, and a lot of the Jingluo theory, such as the idea of Wei Qi movement, is linked to Jingjin theory. And then that theory is also linked to Yuan Qi theory, the source Qi theory, the Sanjiao theory, and that is also interlinked with Jingjin theory. Because we're going to explore in the course that because when you study the Jingluo theory, you basically learn about these pathways that are kind of linear, right? In the classical text, they're less linear, like it starts from here, like the long channel. I mean, it starts actually from here, then it descends here, then it comes, but it's almost like you're following it, right? Whereas the Jingjin, but you might say that's clear, but it actually limits you to some way because it's making you think that lung diseases can only be treated by following that pathway, right? Or maybe using the connection of Biauli theory, exterior, interior, or maybe the large intestine, but it's still following that lines. Whereas the Jingjin kind of breaks us away from that. And one foundational thing about Jingjin theory is not fixated to any point system, right? um, a foundational core theme is like where we find the painful spot. That's the point, right? And we're going to go a lot on that. But that foundational theory actually of Jingjing comes from prior techniques, right? From when the ancient physicians were dealing with abscess. So Jingjing also, its techniques often came from those abscess techniques, and then those techniques were applied to Jingmai theory. And then Jingmai theory was also applied to Jingjin theory. But more fundamentally, Jingjin theory was almost applied more to Jingmai theory, which became the foundational theory. But it's not the only theory. And I think we're missing a lot when we forgo Jingjin theory. And it also, once we start to learn more Jingjin, because that's what I'm mostly focusing on in this course, Jingjin theory, in terms of the channels. Um, and then show you how you could use it to treat internal medicine diseases, pain, and other things, but also the scaffolding, it as a scaffolding basis to to and this is what Hanong Shang proposes, that it's its own theory that needs to be revived. Mhm.
So, in the Neijing, there are several different theoretical doctrines, such as, we've spoken a little bit about it in our previous question about the Jingjin, the Jingmai, even the Yuanqi, the Sanjiao. Can you tell us a little bit? You've already said that you're going to go into the Jingjin theory. What other kind of these theoretical doctrines are you going to talk about in your course?
So, um, I'm going to talk about especially like Wei Qi and Yuan Qi because you can't really talk because Jing Mai uses also Yin and Wei, but it uses Yin and Wei usually in the aspect or the perspective of circulation in the vessels, right? Whereas Jing Jing uses this theories of Wei and Yuan Qi in a much broader perspective. And that broader perspective often is more related to B syndrome. And that B syndrome is a fixation, right? That fixation, that lesion, right? Prior was abscess. And so it kind of shows you how, just like when Wei Qi stagnates, how it can form an abscess, but how it can also form this Jingjin lesion, right? This this knotted sinew, right, that causes a cluster of symptoms. For example, like the heart jing can cause heart pain.
Mm.
That's not an external, um, you know, because often people, when they think jing, they think pain. But no, it can also extend to internal medicine.
They kind of just view it from a like you're treating just maybe like a certain area where they go, or just kind of a local area, but you're
Exactly.
arguing for, how do you say, like a broader scope of application, and even
And
even
even
kind of going into internal medicine.
exactly, and even the local, as they say. So let's say you have pain in your elbow and you find tenderness in the elbow. That itself wouldn't just be Jing theory. I mean, it's part of the Jing, but that wouldn't just be the application of Jing. You have to find the thing that's also causing the most painful aspect of it, right? You can't just needle where it hurts,
Mm.
unless that part where it hurts is actually the most reactive point, right? So in Jing theory, we're we're almost trying to find like the bend, the
Mm.
root. That's so how that goes back to Wei Qi and Yuan Qi theory, it creates a lot because, for example, somebody that has, for example, surgery, when they do an incision, they're going to create scar tissue. They're going to go through the territory of the Jing. And that affects not only the dynamics of the skin. Often, if you ever touch those people's surface, the area where they did the incision is often drier, right? It's harder, and the surface. And then internally, you also feel the scar tissue. And that scar tissue can even sometimes cause intestinal obstructions, right? I've seen a good amount of patients that got surgery in the abdomen and then they had to do another surgery because the adhesion caused intestinal obstruction.
Mhm.
That is easier explained through Jing gene theory. And you could say almost the Yuan Qi pathway got obstructed into the organs, right?
But
First, the Wei Qi got obstructed, and then that becomes interlinked to Yuan Qi through the Jing Jing. So Jing Jing kind of acts like the framework of how to connect Wei Qi and Yuan Qi because it's not limited to the Jingmai pathways, which are limited perspective because they're almost more fixated on circulation.
do you know what's interesting? I was just thinking about the patient that you described, and that, you know, how many people have surgery these days, or scar tissue. It feels like maybe this approach is actually even more applicable now than when it was written, given how many people
Yes.
are, suffering from these kinds of problems.
Yes, and it's not like Ling Shu 11, the chapter in Jing Jing talks about cuts, but it's it's very obvious that's very applicable,
Mm.
right? And Jingmai theory, well, it's applicable. It's just not as direct, I
Mm.
think.
Cool. Thank you so much, Ivan.
Hmm